Hi everyone. The following video is a demonstration of an indwelling Foley's catheterization of a male and female patient, provided by the education team in Amana Village. First, we need to identify and gain consent from our patient. We also need to check the patient's history for any contraindications. Once you are satisfied with this, you can move on to cleaning the clinical area. Clean the clinical area with the appropriate cleaning agents, and then gather your materials. Place an Inco pad on your table to protect your materials. You will need a sterile dressing pack, catheter bag, sterile gloves, the correct size Foley's catheter for your patient, lubricant, sterile water to inflate the Foley's catheter balloon, a 10 cc syringe to inflate the balloon using sterile water, a kidney basin, and normal saline for cleaning. We will also prepare a leg bag for when the catheter is inserted. Ensure you have the correct PPE on, and then prepare your sterile field. Prepare your patient for the procedure. Reposition them to a comfortable supine position with their legs relaxed. You may need to ask for assistance in some cases where your patient is contracted or overly heavy. Make sure the perianal area is clean and observe the area for any issues. Place an underpad under the patient in case of any leakage. Be sure to place the kidney dish down as seen here before proceeding. You can adjust the bed height to the correct setting before the procedure. Doff your clean gloves and observe the correct steps of hand hygiene using alcohol gel. We can now don our sterile gloves. After you have donned your sterile gloves, you can then prepare your sterile field. Be sure not to contaminate any of your materials. Here we are preparing the sterile water to inflate the Foley's catheter balloon. You can observe the correct balloon inflation amount on the Foley's catheter. This catheter will take 3 to 5 mils of sterile water. We will begin by demonstrating a male catheterization. The nurse is preparing a penile sling to keep her non-dominant hand sterile whilst cleaning. Clean from inner to outer, and be sure to clean under the foreskin if your patient has one. Once the area is clean, dip the tip of the Foley's catheter in lubricant, and you can proceed with inserting your catheter as seen here. When you have reached the bladder, you will see urine flow through. Next, we will fill the balloon with the desired amount of sterile water and then attach the catheter bag. You will then pull back slightly on the catheter to ensure the balloon is in place. Moving on to female catheterization, you will prepare all the materials and sterile field as the same. Clean the area from inner to outer as demonstrated. Once you are satisfied with the cleanliness of the area, you can move on to inserting the Foley's catheter through the urethra. Be sure that you are inserting in the right orifice. And again, when you have reached the bladder, you will see urine flow through. Next, we will fill the balloon with the desired amount of sterile water. This catheter will hold 5 to 10 mils. Once it is full, pull back slightly to ensure the balloon is in place and attach the catheter bag using ANTT.